Yeast infections in men, what to know? Yeast infections frequently occur in men, even though they're most common in women. Men over 40 who have type 2 diabetes may face an increased risk for developing penile yeast infections. Yeast infections are usually associated with women, but men aren't safe from these infections, either. The term yeast infection generally refers to a vaginal infection caused by the yeast Candida albicans, and less commonly other Candida species, including C. glabrata, C. parasylosis, C. tropicalis, and C. cruce. But yeast infections, or candidiasis, can affect other areas of the body. For instance, a yeast infection of the mouth is called thrush, or oral candidiasis, and a yeast infection of the skin, such as the armpits and groin, is called cutaneous candidiasis. A yeast infection of the penis is called candidal, or candida, balanitis, or balanitis thrush. The term balanitis refers to an infection of the glans penis, which is the head of the penis. Candida infects the glans penis more often than any other infectious agent. If the yeast infection also affects the foreskin, it is known as candidal balanoposthitis. Prevalence of candidal balanitis, a yeast infection of the penis. Candida yeasts are responsible for 30 to 35% of all cases of balanitis. Other infectious sources of balanitis include streptococci and staphylococci bacteria, herpes simplex virus and human papillomavirus, and a sexually transmitted bacterium called Mycoplasma genitalium. But Candida balanitis is not well studied, so it's unclear how many men the illness affects each year, though it's thought to be a rare condition. Various Candida species, most notably C. albicans, live in the gastrointestinal tract and other warm areas of the body without causing illness. They only cause issues when they're present in large numbers. In fact, about 20% of women have Candida living in their vagina and don't experience any yeast infection symptoms. Candida is commonly found on the penis, with studies suggesting that 16 to 26% of men carry the yeast. About 37% of men with Candida experience no symptoms, while 27% of them develop balanitis, according to a study. Causes and risk factors of candidal balanitis or penile yeast infection. Unlike with vaginal yeast infections, penile yeast infections are usually sexually acquired when a man has sex with someone who has a yeast infection. But candidal balanitis isn't considered a sexually transmitted disease, STD, because men can get the infection without having sex. There are several risk factors that increase a man's risk of getting a penile yeast infection, including antibiotics, which kill the good bacteria that keep Candida's numbers in check, immune-suppressing illnesses, particularly HIV, diabetes mellitus, aka diabetes, corticosteroids. Additionally, Candida yeast colonization and infection are more common among men with uncircumcised penises than men with circumcised penises. The warm, moist environment underneath the foreskin promotes yeast growth. One study found that candidal balanitis was strongly associated with being over 40 years of age and also having diabetes mellitus. And men older than 60 years were more likely to have Candida colonization. Hygiene may also play a role in candidal balanitis development. Washing with perfumed shower gels and soaps can irritate the skin, potentially helping Candida multiply. Symptoms of male yeast infections, candidal balanitis. Common symptoms of candidal balanitis include burning and itching around the head of the penis, which worsens after having sex, redness and swelling, small, rash-like bumps called papules, which may have pus, pain during urination or sex. If you have candidal balanoposthitis, you may also have a thick, lumpy discharge under the foreskin, an unpleasant odor of the foreskin, difficulty pulling back your foreskin. Men with diabetes may experience more severe symptoms, including fluid buildup and ulceration of the penis, as well as fissuring of the foreskin. Complications with balanitis are rare, but may include an inability to retract the foreskin, cellulitis, inflammation of connective tissue beneath the skin, and a narrowing of the urethra that makes urination difficult. Treating penile yeast infections. Like vaginal yeast infections, penile yeast infections are easily treated with antifungal drugs called azoles. There are a number of over-the-counter and prescription-based topical medicines available, including clotrimazole, lotrimin, miconazole, monostat, iconazole, spectazole. In some cases, these drugs may be combined with hydrocortisone, Solucortef, to reduce marked inflammation. Importantly, topical oil-based medication cannot be used with latex condoms. Alternatively, an oral medication called fluconazole, diflucan, is effective for yeast infections that are more severe. If the topical or oral treatments don't work, make sure to see your doctor for a follow-up, as you may have another kind of balanitis or an infection by a Candida species resistant to azole antifungals. It's very important to prevent these diseases from our lives. In case you are infected with these diseases, go see a doctor immediately. Note that this video is only made and created for education purposes. Thank you very much for watching. Please to subscribe, like and ring a notification bell, so you don't miss out any of our videos.